Hello, I'm Michelle Helin. As a registered nurse of 22 years and a CPR and first aid instructor for 11 of those, today I'd like to share with you some information about how to stay safe in the woods and how to be prepared for an emergency. Every year there are hunting accidents caused by many things, and nearly every time they could be prevented. Prevention is so important because it's way easier to prevent the problem to begin with than to try to deal with the aftermath. Those accidents are in the categories of shootings, so your gun safety. Follow the key cardinal rules of gun safety, and please always make sure that your gun is always pointed in a safe direction and you're not pointing it at anything you don't intend to shoot, and that you know your target and beyond. Another category of accidents in especially archery season, also in the gun deer season, are going to be your tree stand injuries, your falls. Please wear a safety harness at all times. Injuries can occur from falls as low as 6 feet off the ground. So please wear a harness. Full body harness is the safest compared to just a simple belt type harness. And be especially careful when you're going from that last step on the ladder onto your stand. And even better, use something like a lifeline type of harness that you can hook into at the base of the tree and have in place until you all the way up and through your hunt to eliminate that hazard. Another category of injuries that occur are bleeding injuries or puncture wounds that occur when we're gutting or cleaning our animals after we've harvested an animal. And that can be minimized, or that risk can be reduced by making sure that you're using the right equipment for the job. A lot of times those injuries occur when someone is using a simple knife or pocket knife, pocket style knife, or just a simple gutting knife to try to cut or break the pelvic bone, and using a hammering effect like this, and then something slips, and before you know it, you got a knife in your femoral artery. So very dangerous situation anytime, and especially if you're on a remote hunt. So using the right equipment for the job, using a bone saw for that, a zip saw, something like that to get through that pelvic bone in a much, much safer way. So prevention, using the right equipment or the right gear for the job. Even with that, accidents can and do occur, and you want to be prepared for not only an accident or an injury, but also a situation where you may be lost or injured in the woods, and it's going to be some time before someone can come and get you. It seems overwhelming because there's so much gear you could have, and how much can you really fit in your backpack? How much are you going to really have with you? And obviously, if it's not with you and on your person, it's not going to do any good. It won't do any good if your gear is back in the pickup truck at the base of the mountain and you're up in the mountain lost. So to try, how do you wrap your brain around what of all this gear you could purchase, what you need, and how to decide what to take? Well, one thing that I recently read, and this was in the March 2015 issue of Outdoor Life, written by Rod Elm, is he seems to have a really common sense approach, I think, to that survival gear. And Rod uses a 3-tier approach. So tier 1 includes the gear that is always on you, on your person, worn or in your pockets. So the critical pieces of gear that can start a fire, and signal for help, primarily. And so in that first tier, which I'm implementing his system, includes paracord that you could then braid into a lanyard or maybe a belt, and attach to that a small flashlight, small knife, something to start a fire as simple as a Bic lighter, a signaling device such as a whistle, and a compass. And then in your pockets, you would have an emergency blanket, a small multi-tool, and your cell phone. Tier 1, you've always got it on your body. You've always got that gear that you would most likely need to use as a first level of survival. Second tier, then, are things that you could wear or have in a small fanny pack that you wear or a small backpack. This includes a small first aid kit, a large trash bag, some signal tape, some duct tape, granola or protein bar. Things that you would need if you're going to be out there for just a little bit longer to treat a wound, more signaling, and even build a small shelter or a simple shelter of some kind. Then his third tier are things that you would have in your main backpack or a larger backpack, and this would include things like a small collapsible compressible sleeping bag, maybe MREs, your water container, appropriate additional layers of clothing, and things like that for a longer trip or a longer stay in the wilderness. So again, I really like this approach that Rod Allen has. If you get a chance, look it up in the March 2015 issue of Outdoor Life. When it comes to first aid, there's several types of first aid kits you could have. So Rod recommends having a small first aid kit in that second tier. So over the years, I've picked up this small first aid kit. Just got some gauze, Band-Aids, a roll of gauze, simple things, because I'm worried about more of those bleeding injuries at that time, just to take care of that emergent issue. You also have first aid kits that you could purchase at your drugstore, at your convenience store. They come in a variety of sizes. This is kind of a medium-sized one that you would have. This is one that we keep in our boat. It's going to get you through a lot of the types of events that you would have. Be sure you check it for outdates. The things in a first aid kit that typically will expire are going to be your medications. Usually the gauzes and those other types of bandage items are going to be good as long as they're not water damaged and not opened. But you do need to check the medications. Then, for bigger trips or events where you would have more likelihood to have injury, maybe to keep something in your vehicle, in your UTV, or equipment out in the field. This case is one that I really like. It's made by Plano. This is their smaller version. There's a handy pack right on the top. This would be the first line that you could grab. And then there are several more of these small boxes that can be labeled and used for different types of emergencies. I like the fact that it's all individually packaged so that if there's any rain or elements that you're dealing with, that you're not going to have all of your supplies get damaged, and you can just grab what you need and go. Lastly, and as a final thing I want to talk about today, but very important, to be prepared, know what to do if there is an accident or an injury. Take a first aid class, take a CPR class, look for those at your local hospitals or technical colleges or local emergency management services. Know the signs of a heart attack, chest pain, nausea, perhaps pain radiating down an arm or up your neck. Know the signs of a stroke That can be remembered by using the acronym FAST, facial drooping, arm weakness, usually on one side, speech impairment or speech difficulty, slurring of speech, and the T stands for time to call 911. We talked a little bit about medications in the first aid kit as being the main thing that will expire. I'm not a big fan of keeping medications in my first aid kit. Most of those are not first line of emergency treatment in an injury, but the one medication that I do recommend keeping in your first aid kit is going to be aspirin. It's pretty inexpensive. You could use it for pain or fever if you're on a trip or need it for that reason, but aspirin is also an important treatment if the individual is having a heart attack and doesn't have an allergy to aspirin or any history of bleeding.